Government panel called the U.S. Preventive Services Task Force has updated its recommendations for who should get screened for lung cancer. The two changes here. One, it lowered the earliest age for screening from 55 years old down to 50, and it now applies to people who have averaged smoking a pack a day for 20 years, down from 30 years.
Really, the expansion of the eligibility criteria for screening reflects that there are certain populations where we are appreciating more and more that the risk can develop at a younger age and with less smoking. African Americans definitely in that category, and probably also women.
Dr. Lynn Tanoue from Yale Cancer Center said about 16 to 18 million Americans will now fall under these new guidelines. And she said one estimate is that expanded screening could ultimately cut lung cancer mortality by 20%, a huge number, considering lung cancer is the leading cause of cancer death in the U.S.
Lung cancer really should be preventable. 120 years ago, it was really rare.
These new recommendations are for yearly screening done by low-dose CT scans. As for cost, Dr. Tanoue said the recommendations help to decide what does and does not get covered by insurance.
When USPSTF makes a recommendation for screening, it should be accessible to everybody. And so that CMS, which is Medicare and Medicaid, should be covering that. And commercial insurers should also be covering that.
Okay, so I want to go over the full recommendations one more time, because so far I've only talked about the changes, not everything. There's sort of a three-pronged test here. You should get screened for lung cancer, or at least talk about it with your doctor if A, you're between 50 and 80 years old, and you've averaged smoking at least a pack a day for 20 years, and you're either still smoking now or you've quit within the last 15 years.